Interesting to know. All right. Well, this is a headline that certainly caught a lot of women's attention. A study that linked being on the pill for more than 3 years to an increased risk of glaucoma. Well, this morning we want to go beyond that headline and find out exactly what this means for the millions of women who have relied on this contraceptive at some point in their life. So we brought in Dr. Geoffrey Emerick. He is here from Hartford Hospital. Good morning to you.
Good morning. Thanks for having me.
First of all, tell us what this study was all about.
Right, so the information was taken from a nationwide survey, and they looked specifically at 3,400 women over age 40 who had had an eye exam and that completed this survey. And they found that those who had been on a birth control pill for more than 3 years did have an increased risk of having been told that they had glaucoma.
And how big was that increase?
So it was a double the risk in those women who had had more than 3 years. Also, people who were African American, they had a 3 times increased risk. So there's several risk factors for glaucoma, and this seems to be some initial evidence that having been on the birth control pill may be one of the risks.
It's certainly worth learning more about this. For folks at home who are not familiar with what, maybe they've heard the word glaucoma, they don't really know what it means. Can you explain that to us? Right,
so it's a fairly common condition. About 2% of people over age 40 have it. There's no symptoms early on, but the good news is that it can be picked up early, and we have great treatments for it, so you can usually avoid any loss of vision with a regular eye exam. So especially if you have a family history, if you're African American, other risk factors, that would be reasons to get regular checkups.
So if there are women who have taken the pill for more than 3 years, they're in that post-40 age group or close to, and they're thinking, well, I think my eyes are okay, but they don't know. I mean, especially if there aren't really symptoms that present right away in the early stages. What should they do with this information?
So the most important thing is not to panic. We wouldn't want anyone to change their behaviors or stop taking the pill because of this study. It's just one study. It just adds to what we know. But just to be aware of that. And again, if there's a family history of glaucoma, if you're in that older age range, if you're African American, important to get regular eye exams at least every couple of years.
And this study is not the end-all, be-all. Probably more research needs to be done here, right?
Absolutely right. It adds to what we understand. Hormones play a role in a lot of medical conditions, and it seems to play a role in glaucoma as well.
All right, and probably the most important thing women can do if they have any concerns at all, as always, I feel like I always say this, but it's really kind of the truth, talk to your doctor.
Absolutely.
Yeah, get that conversation going. All right, Dr. Emerick, thank you so much. Appreciate you straightening that out for us.